കാസർഗോഡ് എല്ലാ പ്രേക്ഷകർക്കും മെഡിട്രാക്കിൻ്റെ മറ്റൊരു എപ്പിസോഡിലേക്ക് സ്വാഗതം. ഇന്ന് മെഡിട്രാക്ക് ഡിസ്കസ് ചെയ്യുന്ന വിഷയം IVFനെ കുറിച്ചാണ്. ഈ വിഷയത്തെക്കുറിച്ച് കാസർഗോഡ് പ്രേക്ഷകരോട് സംസാരിക്കുന്നത് മാംഗ്ലൂർ തെള്ളക്കട്ടയിലെ KS ഹെഗ്ഡെ ഹോസ്പിറ്റലിലെ Dr. Prasannakumar ഷെട്ടിയാണ്. Sir, welcome sir.
Thank you. Thank you.
See sir, today we are going to discussing about regarding IVF.
Okay.
See, actually what is IVF?
IVF is a specialized fertility treatment for those who are childless, which is used in which the eggs and sperm of the couple are handled in the laboratory.
Okay.
For example, the egg is taken outside the woman's body.
Okay.
And the husband gives the sperm sample.
Okay.
And for whatever reason they are not unable to conceive or other methods have failed, then some couples require this IVF treatment.
Okay.
So wherein the eggs are collected from the woman's body, and then in the lab they are fertilized, and embryos are cultured in the incubators, maybe up to 3 days or sometimes in some cases 5 days, and then they are again transferred to the wife's uterus.
See sir, before going to this treatment, when should a couple decide to need an IVF treatment?
IVF treatment is required in some cases.
How they are decided, sir? Is it because after the marriage, after a long time, how we need an IVF treatment? Yes. How can they decide their stuff?
It is a decision to be taken by professional consultation.
Yeah.
After once it is confirmed that they cannot conceive by any other means.
Yeah.
Like for example, in olden days, if the husband's count was 0 or very low, they never used to, there was no other treatment before 1978.
Yeah.
In 1978, IVF treatment came to existence in the United Kingdom, and then now it is practiced worldwide.
Okay.
And early, for example, if both her fallopian tubes are blocked,
okay,
before IVF there was no treatment for that.
Okay.
After the invention of IVF, there is treatment for these certain conditions wherein earlier treatment was not at all available.
Okay.
So it has to be decided by in consultation with the professional fertility specialist.
Okay.
It is not like that I am unable to conceive, I want to have IVF treatment. It is not, doesn't work like that.
Okay.
So having exhausted other methods of treatment and for some other reason she is unable to conceive, for example both the tubes are blocked, there is a problem with the husband's sperm, very severe problem. Mild problems, they do not require IVF.
Okay.
Maybe the age related, because of long married life, wife is very elderly.
Okay.
Or in certain situations where all other treatments have failed. So now in these situations IVF treatment is required.
Okay. See sir, before going to for this kind of treatment, IVF treatment, what are the preparation for? So a couple should how to prepare for that one?
The preparation is certain things patient husband and wife can do. For example, lifestyle modifications.
Yes.
Like for example, if she is overweight, she can reduce her weight to normal levels.
Correct.
If they have any bad habits like smoking, excessive drinking, or any substance abuse or anything like that, or any stress, even in the husband and wife, they can correct those factors. Healthy diet, and positive attitude. And then most important thing is proper counseling by the doctor. And the couple should understand the procedure, that it is a scientific procedure. There are certain limitations and certain how much percentage of success can be achieved in each couple, that is individualized. So they should not think that every couple who is entering the IVF treatment will succeed 100%. So all these doubts should be clarified before the treatment. These are the preparations, and of course, the medical conditions and any other extra treatment or any procedure is required is to be decided by the gynecologist.
Okay. See, sir, for this procedure, how long it will take, sir? That before that, already sir mentioned that preparation that regarding husband side and wife side. Then during the procedure, how much time it will take for that one? Say a prolonged procedure, or how much is that time? After carrying, okay, sir, it should have naturally its own time.
First of all, one thing I want to tell you, Mr. Harish, like not every couple will require IVF.
Yeah.
Suppose if it is a minor problem, the only problem is they are not spending enough time with each other. They are young couple.
Yeah.
Semen analysis normal. Wives, all the tests are normal.
Okay.
All that is required is they have to spend some time, and then maybe some minor treatment may work.
Yeah.
But if for some reason IVF is required,
okay,
what is the time frame is required is before doing the actual IVF treatment,
okay,
the month before the thorough evaluation has to be done. Certain tests, maybe the wife's husband semen analysis, wife's ultrasound, and tests for ovarian reserve.
Yeah.
How much eggs can be obtained from the wife.
Yeah.
The certain hormonal tests may be required. So entire procedure may be a week of evaluation before the procedure in the preceding month.
Yeah.
And once the treatment starts, all these treatments start on the first or second day of her cycle period. From that time onwards, about a month or at least 15-20 days is required for the IVF procedure to come to, from start to finish. That may be the timeline.
Okay.
Because once the embryos are cultured, and you need not immediately transfer.
Okay.
In some cases we can transfer in the same cycle.
Okay.
But in some cases, like our embryologist explained, we may freeze it or cryopreserve it. And we may call the couple later for embryo transfer.
Okay. See, sir, certain times we have seen that multiple births are came.
Yes.
Usually in IVF case, how it happened? What is the reason?
Multiple pregnancies happen because sometimes we transfer more than one embryo.
Yeah.
So normally we avoid according to the regulations, no more than 3 embryos can be transferred.
Okay.
Maximum number allowed is 3.
Okay.
Sometimes in older women we may transfer
More
2
than,
or 3.
More than,
so sometimes twins can happen, very rarely triplets.
Yeah.
But usually most of the times single pregnancies will happen.
Okay.
If the couple particularly wants single embryo transfer, that also can be done.
Okay. Yeah. See,
only thing is the embryos have to be grown for up to 5 days, and the quality of the embryo should be very good, and enough number of embryos have to be obtained.
Okay. So what is the success rate of this one, sir, IVF?
Success rate of IVF depends on various factors.
Yeah.
Like for example, the most important factor in the success of IVF is the age of the female partner, that is the wife.
Yeah.
The
that
younger
is a
you are,
prominent fact, I think, that the female part is the
female
correct,
partner.
because they are okay.
Of course, the husband also has to be. Earlier we used to think that husband's age is not very important, but now we know that
one
husband's age beyond 50, some sperm abnormalities also will be present.
Okay.
So younger the couple, better success rates. I would say around 40 to 50% in a very good, favorable couple.
Yeah. See, so one more question. See, most of the patients are saying that IVF treatment is very costly, because we have already seen that so many complicated procedures are here. Then why they are saying like that? Because is it really costly?
It is costly because of the infrastructure required, as you have already seen. A lot of expensive equipment has to be installed, and the
well-trained persons
expertise required, trained embryo. It is not only doctor's job.
Yeah, it's a teamwork.
It's a teamwork of doctors and embryologists. They are people who work with the sperm and ovum and embryos.
Okay.
And they do only the IVF procedure. So it is a teamwork, and the infrastructure required and the sterility which has to be maintained in the laboratory.
That's why maybe
the conditions increase. And the hormone injections are very expensive.
Yeah. Maybe that is one important factor for
but
that.
As time goes on, because of the scale, it may come down. If you remember, when mobile phones used to come, they used to be very expensive.
Cost is very expensive.
Later on, because of other factors and as the technology progresses, it may come down in future. Already it has come down.
Okay.
Especially in teaching institutions or non-profit, setups, the cost is reasonably lower. Though not very cheap.
In future, we will see again it will reduce the cost. Correct. See, in Hegde Hospital, see, a specialized, we have already seen that it is already explained this episode. We have a well settled IVF lab. How long it will start, sir? Here, sir?
No, we have started this lab in end of 2013.
Okay.
Actually, in fact, in the entire city of Mangaluru, we were the first medical college to start the IVF
center.
Our management and especially our chancellor felt the need that every couple, irrespective of their financial status, has to get access to state-of-the-art quality reproductive health care.
Okay.
So, with their support and full encouragement, we were able to start and sustain this IVF lab for so long.
Okay.
And now we have also started training programs for budding embryologists and as well as clinicians who want to train.
Okay.
We have a fellowship program in reproductive medicine.
That one also doing, training program and other fellowship program also doing. See, sir, this IVF treatment given, is it an IVF specialist or gynecologist or what? See, who can give IVF treatment?
Yeah, very good question.
Yeah.
Actually, now the recently introduced ART law in 2021, 2022, in the beginning of 2022, has very clearly spelled out what are the qualifications for IVF specialist gynecologists as well as embryologists.
Okay.
So in this case, anyone, he should be basically a gynecologist. He or she should be basically MS or MD obstetrics and gynecology. Then they should have done a fellowship or master's subspecialty training fellowship or program in fertility, reproductive medicine and surgery.
Okay.
Or those who have already been doing IVF, they should have senior people who have already been doing, they should have performed so many number of procedures. This is all spelled out in the ART law, which is gazetted.
It is already there.
It is already there.
It is law. Okay, according to that.
Without having performed so many, so I should have done n number of, according to the law, 50, at least 50 to 100 egg collection procedures. For example, an embryologist who is then 500 lab procedures, like that logbook has to be maintained. Or the future gynecologists who want to do it, they have to undergo a training. So without this, you cannot run and these labs have to be accredited by the appropriate authority appointed by the national board.
Okay.
So our lab has already been inspected and given the recognition for this procedure. You have to be registered on their roles as a ART clinic, Assisted Reproductive Technology Clinic.
See, sir already mentioned that. See, actually, age is a factor for this for this treatment or the IVF procedure. So actually, what is the age limit there, sir? Any miracle will happen to this one. Sometimes we have seen that news. We have seen in media some even after 47 or 50, that IVF treatment, they will get more than multiple pregnancy. Like that, we have seen that. We read that.
But now the law has, ART law passed by the parliament in 2000, which I mentioned, has already specified the lower limit as well as upper limit. You cannot do IVF for a woman less than 21 years of age or any ART procedure, including IVF.
Okay. Correct.
And upper limit is up to 50 you can do procedure.
Okay.
You may ask 50, they will stop menstruating, how will you do? But donor procedures are there. Even with the donor, you cannot do it for a 60-year-old or 70-year-old woman. The upper limit for the woman is 50. Similarly for men, it is only 55. So beyond that, the law doesn't permit. But of course, they may petition the court, and court may grant in special cases. That is a different matter. But ART, the age limit is there.
Okay. See, so you have already mentioned regarding that donor. So what is the donor program, that one, sir?
Donor program, or it is also called as third party reproduction. You must have heard about surrogacy and donor egg or donor sperm. In some cases, no matter how much, whatever we try, either the eggs are not available or not of good quality, or the sperm is not available or is not of good quality, or repeated IVF failures, then we may have to go for donor programs. So that is also under strict regulation from the ART authorities. There are certain guidelines. We can obtain donor eggs or donor sperm and help them have a child. But there are certain strict regulations which are already in the public domain. Who can avail all these things, and normally the donors have to be recruited through ART clinics. So they have to be registered by the government, and with the anonymity, confidentiality maintained, with the regulations we can do the donor program.
See, one doubt, sir. See, each and every IVF center, that donor, this one sperm bank or this egg bank, is it there, or it is must, or it is compulsory, or they will take other side from?
If we want to start a donor bank, we have to register separately as a donor bank.
There also,
we cannot directly you cannot recruit donors here. So I have to have a MOU with the Memorandum of Understanding with the donor bank, and from there we have to
collect the egg and
either they will send the donor or they will send the sample. And the records have to be maintained for so many years.
That should also, so very strict this one, logo and other things. Sir,
and one donor can give only for one commissioning couple, and they cannot give to multiple people. So how many times one donor can donate? These are all, and what is the compensation, and what is the insurance made for the donor.
So many
so all these are specified, and you have to make an affidavit from the notary public or the metropolitan magistrate. The commissioning couple has to get an affidavit also.
See, for this IVF, for the procedure, sir, how to decide, sir, the donor? What is the criteria for example? See, two couples are there. How to decide that one we need a donor, and what are the criteria for selecting donor egg and sperm?
For the donor, like I already told, the woman doesn't have any eggs. Because after the woman has achieved menopause, her ovaries will not be producing any eggs. So whatever injections you give, she is not going to produce any eggs. So in such cases, she can request for a donor who is a younger female. She can give eggs to her as a altruistic donation, and then the eggs are collected. Of course, she will be given reasonable compensation by the agency, and those eggs are fertilized by the husband's sperm. Similarly, in some cases, sperms are not there. Zero count is there. Whatever you do, sperms cannot be obtained. In such cases, anonymous donor sperm can be obtained from the registered donor banks, and with their consent and proper counseling, donor they can have a child.
Yes, sir. We have already discussed.
And similarly, in some cases, the woman does not have a uterus, or uterus is not healthy, or the woman is so unhealthy that she cannot carry a pregnancy to delivery delivery. Such cases, another healthy woman can deliver a baby for her. That is called as a surrogacy or gestational carrier. That is also permitted under the law, under strict regulation.
For this, all these things have strict regulation and laws are there. We should follow that one.
Yes.
See, Prasanna sir, this is IVF 40. So we have explained that one. What is the embryo is done. Say before that, what is the procedure here, sir? Or after that procedure, came.
Once the patient is started on IVF treatment, after she has given the hormone injections, when her eggs are ready, there is a small procedure to collect the eggs.
Okay.
Now it is the husband can give the sample in the collection room. How
okay.
to collect the eggs from the woman's body.
Yeah.
So it requires a small procedure called egg collection or
okay.
oocyte pickup.
Okay.
There are different names.
Okay.
They just mean that you are taking the eggs out of the woman's body.
Yeah.
So that requires a small anesthesia for about, it lasts for about maybe 45 minutes to 1 hour.
Okay.
And the patient is brought here.
Okay.
And under the ultrasound guidance,
okay.
Through this specialized needle, we are aspirating the fluid containing the eggs. And that fluid is given in that these tubes.
Here, sir. Okay.
Yeah, these are actually in the body temperature.
Okay.
And they are warm.
Immediately after tubes. Taken, directly
after aspirating the fluid from the ovaries, it is filled in these tubes.
Yeah, okay.
Maybe because of this reason they are calling it test tube babies, but it is not actually done in the test tubes.
Storing this kind of thing. That is why they are calling
only
it.
The fluid is taken here and given to handed over to the embryologist.
Okay.
And they will search for eggs in this fluid.
Okay.
And then they will do all the manipulation and
from there
they will fertilize the eggs and create embryos are cultured in the embryology lab.
See, sir, just mention that one, sir. They are using that tube. We are taking the eggs. Okay, that procedure is how much? Only 45 minutes. How much needed, sir, for that procedure for taking eggs from female body?
You mean the time?
Yeah.
Yeah, it's about whole procedure may last about an hour. The procedure is very small, but a lot of preparation has to be done.
Immediately
and specialized, you have to connect the needle to the that probe, ultrasound probe.
Okay.
And then there is a specialized suction machine here, which draws that fluid in minus 120 millimeters mercury. Because if you have a lot of suction, the eggs will be damaged.
Okay.
So that particular specialized instrument suction machines are there.
Okay.
And if suppose this breaks down, I have a backup also.
Okay.
So I always keep two like this.
So immediately after the suction, it is filled here, that tube. Then at the same time, they will transfer to other embryos.
Through the ultrasound from the woman's body, it is aspirated. It is through the same way we do the vaginal scans. Through that, we are passing that specialized needle, which I showed you. And it is connected to this test tube, and that fluid one by one we are giving. So whatever number of eggs they are retrieved, they will fertilize. At the same time, husband will give the sample. In the outside room, and then they will give the.
So this procedure is done in IVF OT.
In this OT. And similarly, another procedure which we do after the embryos are ready. And whenever the patient's uterus is ready by hormonal preparation, then we use a specialized embryo transfer catheter. These are all highly specialized small instruments. And through this, they will load the embryo and give it here, and it will be transferred to the patient's.
That procedure also in IVF OT?
In here only. There is no other procedure done in this OT except
only these two procedures.
And these are particle filters are there, and the air is highly purified. Every minute the air is changed. So many thousands of times. So whatever you are breathing, air is
that will also change.
Will be newly circulated. So only this is used exclusively for the IVF procedures.
These two procedures.
So rest of the things after the eggs are given, what they are doing here, Professor Swami has already explained.
That is the second procedure. See, sir, how this embryology lab working?
Thank you, Harish. I am Dr.Prasannakumar Shetty. I am the head of IVF department, Chema IVF at Justice K.S. Hegde Charitable Hospital attached to NITE University. And here I am joined with my team of embryologists led by Professor Dakshinamurthy Swaminathan and Ms. Mayuri Chatterjee, embryologist, Ms. Princy D'Souza and Niharika. This is our team of embryologists. And every IVF lab consists of a team consisting of an obstetrics, a gynecologist who has specialized in infertility and especially in vitro fertilization.
Okay.
And we take care of all the fertility problems of the couple who wish to have a child. And to come to this particular scenario, this is the in vitro fertilization lab where most of the so-called test tube baby treatment or the in vitro fertilization work takes place, and it is the initial part of the fertility care is handled by the gynecologist, including the initial consultation and evaluation of the couple and the advice to be regarding the treatment undertaken. And if the couple requires in vitro fertilization, she is given the hormone injections so that her ovaries are stimulated to produce a good number of eggs without compromising her general health. And a procedure wherein the eggs are collected is undertaken under a light general anesthesia, which is done next to this room in a small OT, which is a dedicated operating theatre only used for egg collection and other related procedures.
Then what kind of procedure here is happened?
Here, if you can see the hatch there, after the collection of the eggs, the fluid containing the eggs or the follicles is handed over to the embryologist.
Yes, sir. The sir told here is a good team. Then what is the contribution of this other rest of them, sir?
Yeah, exactly. The contribution for IVF is mainly done by the embryologist, who makes the oocyte, what we call scientifically, the other name, colloquial name is egg, what we call general, and the sperm from the husband is fused together and created as an embryo. That is the first stage of life. We all born like that naturally. That we are doing in the lab. We are not doing anything different here. We are just adhere to the nature. We are helping the patients to assist, which is not happening naturally in the test tube, like in the fallopian tube. Naturally fertilization takes place. That's what we are doing it here. So it is very natural to this called it's assisted reproductive technology. We just assist the nature. So for that we use different kind of instruments to keep the embryos viable and sterile. The culture system, what we call, is very, very important. So it's not like that number of embryos what we are creating. It is that the importance of embryologist role is that we have to create a viable embryo, which will get implanted when we do the embryo transfer. So it is a highly skillful job. One should know the responsibilities, and we have the ART law in place in India. So we are given set of standards. So we have to adhere to that, and we have to take care of all the necessary things for the beginning of the life.
Sir, we have seen that so many machines are here. See, what is the contribution of this machine? We can see that.
Yes. Basically, this is called So basically, this is called laminar airflow, where it will give the sterile air. We use the microscope to assess the embryos and the oocyte and the sperm, because these are all very, very microscopic. So this is used as it will blow the clean air so that we will maintain the sterility, and the temperature should be maintained always. So all our work will done under 37 degrees centigrade.
37
degrees centigrade. That is the body temperature. So that we can measure here. So if any variation is there, we have to be particular. Then the same thing will go to the incubators. This is called incubators. So this will use it. Then here also it maintains the temperature, pH of the media, what we call it, and the humidity. These three parameters are very, very important to get a embryo. Then we have the micro.
How long this embryo will
This depending upon that. We can do the embryo transfer on day 3 or day 5, depending upon the patient. That clinician will decide. So there are other clinical parameters which look into the patient, how endometrium is there, whether it is receptive or what. Then clinician will decide, so on so date we will do the embryo transfer. So it is not mandatory that we have to do on the same cycle. We can freeze it also. That's called vitrification. It's one of the novel technique. It is almost done in almost all the labs in the world. where we can.
What is the need of freezing in that mode?
So like if the patient is not ready for various reasons, what we can do, we can freeze the embryo at minus 196 degrees centigrade. So it will go to the hibernation mode. There won't be any aging process. So the embryo, it is safe for the embryo. It is well proven technology. Throughout the world, almost 99% of the IVF centers, they use vitrification. It's very quick, very safe. So there is no issue at all. So no need to worry about that, when we put in minus 196, what will happen. It is a well proven technology. So then when we create when we create the embryo, there are two types. One is IVF, where we will just inseminate the semen and the oocyte will select the sperm until it will become an embryo. When the male patients, when they come with compromised semen qualities, where they have 1 or 2 sperms or less sperms, azoospermia, obstetric azoospermia, where we will aspirate the sperm and we will inject ourselves manually. That is called intracytoplasmic sperm injection. For that we need a sophisticated instrument called micro manipulator, where we will hold the oocyte in a small capillary and we will take a good sperm and we will inject manually. The embryologist will do manually. So in nature it takes on its own. Because we put a number of sperms, then it will take. Here the compromised sperm quality, we have only handful of sperm sometime. So then we have to select, inject inside. Then it will become an embryo. The process of fertilization is different in IVF, in ICSI. ICSI is done by the embryologist. There it is very natural. But once it is fertilized, the process is the same. Once we put it to the incubator, then it will grow on its own. So the intervention here is that for the severe male factor infertility, where we use our skills to fertilize the neosia. It's one of the highly skillful techniques. ICSI and vitrification is mandatory for the modern embryologists. Without that, we can't do anything. Yeah, thank you.
See, sir, we have already discussed about IVF, what is IVF, how it happened, what are the procedure, what is donors, everything we have discussed. Shall we wind up this program, sir?
Definitely, thank you.
Okay, Kasaragod Meditrack in the episode in the wind up episode, Kasaragod സംസാരിച്ച് ഈ എപ്പിസോഡ് നമ്മൾ ഡിസ്കസ് ചെയ്ത വിഷയം തന്നെ IVF ആണ്. വളരെ ഇമ്പോർട്ടൻ്റ് ആയ ഒരു IVF എന്നുള്ള ടോപ്പിക്കാണ് ഡിസ്കസ് ചെയ്തത്. എന്താണ് IVF, എന്താണ് അതിൻ്റെ പ്രൊസീജിയർ, പിന്നെ അതിൻ്റെ ട്രീറ്റ്മെൻറ്റ് ഏതൊക്കെ രീതിയിലാണ് നടക്കുന്നത്, ഈ വിഷയങ്ങൾ വളരെ ഡീറ്റെയിൽ ആയിട്ടാണ് കാസർഗോഡ് പ്രേക്ഷകരോട് സംസാരിച്ചത്. ഈ വിഷയത്തെക്കുറിച്ച് കാസർഗോഡ് പ്രേക്ഷകരോട് സംസാരിച്ച മാംഗ്ലൂർ തെല്ലക്കട്ടയിലെ ഹെഗ്ഡെ ഹോസ്പിറ്റലിലെ IVF സ്പെഷ്യലിസ്റ്റ് ഡോക്ടർ പ്രസന്നകുമാർ ഷെട്ടിക്ക് കാസർഗോഡ് നന്ദി അറിയിക്കുന്നു. അപ്പം എല്ലാ പ്രേക്ഷകർക്കും നന്ദി, നമസ്കാരം. താങ്ക് യു സർ.
താങ്ക് യു.